having been on the front lines with my colleagues in public health who are actually talking to these people who are at home and who are self-isolating at home, most people are absolutely doing what we need them to do. And our testing strategy, as I have explained a few times, has changed so that we are focused. The large number of tests we're still doing, over 3,000 tests a day, we're focusing on those most likely to have this disease and those most likely to need health care or hospital care. So that is an important strategy. It's not that we're decreasing the number of tests we're doing, it's that we're focusing the testing on the people who are most likely to need the health care services. And we are still maintaining the contact tracing. We're talking with people who have this, who have mild enough illness that they're able to stay at home. And for the most part, that is working. I think we need to, and I've been saying it a number of times, we need to understand that this is now being transmitted in our communities across the province, and that is why it is so important for all of us to do our part around staying home if we're sick at all, around making sure that we self-isolate, and that does mean not going to the grocery store, not going to the drugstore, not going outside our property if we are sick ourselves. You know, I think all of us are anxious about what's going on in our health settings. The numbers that are really true, if you will, about the more severe cases are the numbers of people that we're seeing in our hospitals and the rate that people are coming into the hospital. And as you know, much of our outbreak, particularly in Vancouver and the Lower Mainland, has been focused on long-term care homes. So focusing our attention on making sure we're doing everything we can in those settings is incredibly important. But it's challenging for all of us to not know what's coming in the future. And particularly when we hear about shortages and we watch what's going on in the world around us, you know, we don't know what's going to happen in the next week to 2 weeks. We can only continue to watch, continue to prepare, continue to make sure that we're doing everything we can, and to ensure that the rest of our community is doing their part too.